Thank you very much for these nice words, and I'm very happy to be there for the chairs in transition psychiatry. You will see further why. So, when I discuss with European people working in early intervention, usually they just ask me, but what is happening in France? So I call it the French paradox because we have a good health system, but still, as you can see here, comment on fait pour... Sorry, that's a word. We're still very bad for early intervention. That's the right part, if you don't know the geography of France. So, yes, not only we are still blocked in our old model, but we don't want to change. You know also that French people like to fight, they like to complain, and they like to make strikes for those people traveling in Europe. But I think really things really need to change. By the way, that would not be very user-friendly now because it's very old. It's more my generation. Okay, so psychosis, that's quite that kind of a picture we learn, and things that didn't change much when you go on the internet. These are professional sites, and you can imagine, of course, the shock when young people see that. But we have to keep in mind that it's those young people that will experience such traumatic experience. And we have still keep in mind that there are still those young people, even though the psychotic symptoms appears. So what we learn also, and what we have learned for this last year, is that first, psychosis is really heterogeneous. We also know now that the boundaries with different disorders, and especially with neurodevelopmental disorders, are not so clear, with a possible continuum between autism spectrum disorders and psychosis, and especially with psychotic symptoms appearing during this transition period of adolescence. And we know also that it's evolutive, and well, this seminal paper in Nature, well, one of the most read paper about schizophrenia in this famous journal, invite us to rethink schizophrenia, not like a disease, not like a static condition, but more like a progressive condition. So definitely we need to take into account this developmental period, but also the, do we have a pointer? Non, ça marche pas. Ah, ok. Sorry. Non, c'est pas ça. Sorry, I'm very bad. Not only, well, developmental aspect, but also this period of time where the change in the brain are really huge and modify all the behavioral control. What has been explained also this morning. We have learned a lot of things about schizophrenia with a little bit of information regarding the early modification in brain formation that could lead. Actually, these are risk factors to see psychosis appearance. But also we have learned now that there is this brain reorganization during adolescence period where the first symptoms appear. The problem is that schizophrenia is somewhere here, not even the first episode. It's here. There you are in the, well, you are in the chronic condition where the evolution and the dynamic changes are done. And again, if this period of time is a window of vulnerability for stress, for cannabis, for alcohol, it's also probably a window of opportunity if you want to find what could modify the disease course. So the staging model has been challenged by Jim Vanos this morning, but I agree partly. But at least, well, I agree with him, actually. You cannot not agree with Jim Vanos. But at least it really also opened to a new conception of psychosis. Regarding care, there's more to say. But then again, you have to take into account this different stage. Well, pre-morbid phase, where you have vulnerability signs, but you're not ill by itself, and then first symptoms, not very specific, and then attenuated psychosis, and then the first episode, and again, psychosis by itself. But again, most of the patients come here. So you have what we call the duration of untreated psychosis, which is rather, should be called a delay for treatment or loss of chance. Because we know now that the duration of untreated psychosis is clearly a prognostic factors that impact on the response to treatment, and of course also on the impact of the disease on the person trajectory, life trajectory. In France, we don't know precisely what is the duration of untreated psychosis, but it's probably around 1 to 2 years, and sometimes much more. But still, you can see that if you want to address this period of early psychosis, the emergence of psychotic symptoms, you have a large period of time where you can act and detect those people. An important thing you have to keep in mind is that if you define these criteria for ultra high risk or clinical high risk persons, you have to keep in mind that only 1/3 at the most will develop severe disorders and especially psychosis. Some of them will just have these symptoms remaining, but with no major disabilities, and in some of them it will just disappear. So we conduct a large studies in Paris where we included patients with determine the at-risk states, not at risk, and well, psychotic patients were not followed for 1 year, but the other people were people were followed for 1 year with several testing, and we used this cohort for different kind of studies. One of them was to try to understand what is happening during psychosis transition. Most of the studies regarding biology right now are mostly trying to find the best biomarkers that predict the outcome. When you try to look at those biomarkers, it's the first part of that. You just see who will become psychotic between the 2 points, but you measure that at baseline. Okay, you see a baseline, and then you see whether there are differences between those who will develop psychosis, by contrast to those who will not develop psychosis. What we did in these studies is that we look at the changes between those patients who developed psychotic symptoms compared to those who did not. And when you see this picture, I will tell you what it is really, but you see that there is a difference. These went psychotic, the other people not. So you see a difference. So we might be able to identify the process involved during psychotic transition. It's very important because then we could identify new targets for therapies that will help to refrain the disease to progress. And the important things are actually, so this is our a study of epigenetics, and especially methylation. It was data-driven experience, so we did not do any preliminary or a priori hypothesis. And when you look at the most different signals between the two groups, what we found is that it was not related to dopamine or serotonin or whatever. It's related to oxidative stress, inflammation, neuroplasticity, lipidomics. So that might be, well, targets for therapeutics, but also it's interesting to see that it's not really specific of psychosis. You can probably find the same kind of abnormalities, and we know that there are some abnormalities also in depression or on anxiety, on PTSD, etc. So it's really important because maybe we can think that you have to think about the vulnerability, the background of the person, and then another superimposed process, which is evolution into the disease. So, what also is interesting that we know that lipidomic can be treated with omega-3 treatment. Oxidative stress can be treated with N-acetylcysteine, NAC. Homocysteine and folate deficit can be treated with folate. So we could have targets, very simple ones, non-stigmatizing, not changing the brain, but just helping the brain to cope with all the processes of maturation. Okay. Just a quick look about this cohort, what we get in the center of Paris. So mainly males. The age is around 21. This outpatient clinic is called Centre d'évaluation pour jeunes adultes et adolescents, so Center for Assessment for Young Adults and Adolescents. Most young adults will not go to Maison des Adolescents because they think that it's not for them. So we try to differentiate. We have a Maison des Adolescents just 100 meters from our center. So it's rather young, actually, because we see a lot of people with below the age of 18. Most of them have a comorbidity. So I found these numbers because, I stress this number because when I discuss with other people, they say, well, okay, why do you want to treat those young people that are not really so ill right now? We have so many people in hospitals with chronic condition. Well, yes, okay, but still they are not so ill, but they already need care and have and request some therapeutics and support. That's a referral. Most of them came directly through a website, very simple one, just one page. But when you look whether they had previous contact, they almost all had a previous contact. So we have a real problem in the center of Paris, with many places where you could see doctors or psychologists. The referral the time between help seeking and referral is around 3 years, and the duration of untreated psychosis is more than 1 year, and it's in the middle of Paris. So it's very accessible, it's free, etc. So we have a real problem. Maybe that can be one of the problems. This is 130 structure from the GHU. So the GHU now is Hôpital Sainte-Anne in blue, Maison Blanche, Perret-Vaucluse, and associated with this part. Sorry, this one is not in the GHU. So the yellow and 130. Find your way. And that's for the sectorized, so community-based structures. Then you have also the university department, okay, in Paris. So there's someone you will see Maison des Adolescents, you have the Institut Mutualiste Montsouris somewhere here. So there are many, but the organization is not the same. That's another problem, because the connection is not so good. Another point also in France is that we have these community-based mental health services, which are actually very good for chronic condition. It's very accessible. You have social workers. It's very close from the place where people live. You have those university departments where you can have good training, innovation, research, etc. You have also general hospital outside of Paris, where you have also psychiatric, and especially all the emergency are in another place, general hospital. And then you have this kind of strange things, which is medico-social structure, which are usually with one doctor within a large, with a half-time or duty in the place, and a lot of social working, and mostly for housing, adapted activity, and so on. But it's not the same direction and coordination at the regional level. And then I added Maison des Adolescents, because actually some are from sanitary origin, some are from medico-social origin. So very complex, no clear picture, and nobody understands anything. Even the professionals are not aware of all the structure. So we need to have really something to be done. These are in French, sorry, I could not translate it. A question, sometimes people say that there is a exception française, French exception, especially regarding to language. So you have to fight if you want to put in your survey question related to psychotic-like experience. And we did a survey. The full survey is on representation of mental health among people from 15 to 25, parents and teacher. 600 young people, 600 parents, and 235 teachers. And we ask what they think about mental disorders. I don't have time to present the whole things. But I really, and it was done by Ipsos, which is a very large company for survey. And I had to fight with the guys. We were paying, so he had to do that. To include some questions related to, well, psychotic-like experience. And the question was, during the last 30 days, did you have ever experienced one of several things that are listed there? To say inappropriate things or to lose thoughts, your thought discourse. That things can have a specific meaning that for you only. That people want to laugh at you and want to harm you, etc., etc. Telepathy, and the questions are very clear. And you see there's a response. So the first wrong thing is that there is no French exception. Young people, when you ask them to answer questions, they can answer to questions, and especially when they are in front of their screen and they are very anonymous. So we could use those kind of tools to make like a screening. And when you see this 2 or 3% of who experience often one of these signs, I would like to see them in a early intervention system. So altogether, 58% have already experienced one or several like symptoms in the last 30 days, and 10% have experienced frequently at least one, which is very similar to other surveys. So there is no French exception, and we have to. We also ask toward which people they could address if they were experience such symptoms and such problem, because it was larger than just psychosis. So the family are in first, friends, and the first professional is a GP. Psychologist is not so bad. Internet and school is only there, 4%, 2%. So we also have, and when we ask why, well, they find that they are afraid of privacy, confidentiality of the information, and they thought that they were not trained sufficiently, and they was disappointed. So yes, school of course is important to have in the picture, but we have to work and train people, and maybe also have maybe those trained young people that could be an advocate for mental health. So based on all this consideration, we applied. I said we because we are 13 partners in this project. We applied to a grant trying to answer the different difficulties we have to deal with early intervention, especially in France. So this, well, you know that, but we told already, that psychosis is a result of a complex interaction between early phenomena, early events, and environmental factors during the period of maturation of adolescence. And we know that the functional impairment is early and even before the psychosis, the onset of psychosis. So the early intervention wants to limit and prevent chronicity and limit the burden of cost, of course, and we'll consider the ultra-high risk and first episode psychosis. And the hope is to reduce even the emergence of a full syndrome. So the project name is Psychiatry. Actually, the kickoff was on Wednesday, very, very recent one. 5 years. The central hypothesis is that we want to promote neuroprojection and neuroplasticity to attenuate the consequence of developmental insults. So if you want to do that, you have to detect those patients with more developmental burden, and you have also to personalize your treatment. So that's the 5 aims: improve early detection, prevent chronicity, introduce precision medicine in early intervention, which is not so well done right now, translate knowledge to clinical settings, very important in that kind of project, and especially it's very good to have knowledge, but right now the knowledge is not even translated to the clinical world. And improve awareness and access to care, because otherwise you will not have any patients. But if we want to adapt, when you say the name is preventing psychosis through personalized care, then you want to personalize and adapt to stage, of course, developmental burden, comorbidity, including rare disease, but also age, because we all know that they are not using the same way of communication, and so we have to adapt to that. So the project itself will be based on the knowledge and experience of the different partners. I told already about that. Multimodal machine learning, not only based on brain imaging, but also on different kind of information, including motricity, with a digitalized tool, including discourse analysis, which has not been done yet in French, but there are very interesting results in English. We also want to use, the ontology to improve our capacity to extract knowledge and information from natural text, and also use virtual reality, a serious game to train the patients. This will be based on the réseau transition, where here it is. We were then 24 clinical centers, now we are more than that. We have also a relation with the international consortia. And the main thing is that we can now, from the new way of analysis, not only see difference between groups, but make individual prediction. And that's a very important point. So different work package, biology, MRI, clinical and cognition, a very complicated computing machine. The idea is when we include the patients, the practitioner can have a full, not a full, we have to select some aspects, but a comprehensive assessment of different dimensions. And then they will have a decision support system to orient, to optimize the checkups, the different examination, and also the treatment, of course. and we'll have a full work package on real-life implementation with a lot of work with the users and families. And this will be based on the integrative portal, where you will find, first of all, defining needs and strategy. We will use a participative survey with the families, where all the families can go and tell what we should modify to improve early intervention. They've done. It's an INSPIRE project. It has been done already for other disease, somatic disease, clinical assessments, and then to have a application that will help to make communication and connection between the different people around the patients, and especially between the case manager, but also the patients, the carers, peers. What we want to do is to, we will first ask to make focus group and ask to the patient and young people and parents and professionals. But we anticipate that it would be a great idea if the patients could say, when I'm in trouble, I want to that this guy or my friend or my parents, this parent, not the other one, can have the information that I'm not well. So so he can decide to which people we should be aware of his troubles. But also we know that it's very complicated when they have several meetings, and we know that when one meeting appointment has been missed, sometimes young people don't want to go back because they know that they are afraid that they could be they can have trouble with the care with doctors or with the psychologist, which is of course not important. Most important is that the follow-up is still there. So we will also include the patient himself to report experience and try to include CBT-based support within the application, and of course dissemination. Okay, so altogether, this clearly. Of course, psychosis is not the only bad outcome that could come from disorders in young people, but it's a severe disorder, so we need to also to continue research about that. We also need to really to make the paradigm change. The model has to change because clearly we have also to take into consideration all the other possible outcomes. A big problem is the problem of the stigmatization. We will not. It's really strange because patients with only anxiety disorder will go more easily to see a psychiatrist than people with psychosis. Of course, it's sometimes difficult for people to understand what is going on, and even more to describe what is going on, but also because they feel that they are losing a little bit of control, and they feel that they could get mad, and that's terrible. So we really need to make people understand that having some psychotic symptoms, attenuated psychotic symptoms, is not a big deal. Actually, we see that many of the adolescents do have such manifestation. The problem is that when you have trouble with school, with your life, and then you need to get help because you will not be able to do it by yourself. So we have to really to work on that. We have to improve training, information, coordination of the different professionals because it's a nightmare. And that we try to do in the Région Transition with the French-speaking branch of UPA also, because there is clearly a deficit and a need for French-speaking tools. And we are working together with Philippe Conus and Amal Abdelbaki in Montreal for that, with training session and so on. Okay, I think that's all. And for French-speaking people, we have also a specific diploma organized in Paris. Thank you for your attention.
Thank you so much. It sounds like there's a promising road to go there if we really would be able to do some preventive work other than generalistic preventive work that sounds like rather more specific, maybe for psychosis.
Or specific of progression of disease, yes. And especially stress-related disease, like
we don't have much time, but is there anyone who wants to ask a question? Do you think now already people need to do early detection actively?
Yes. You're not more in difficulty when after you see a psychiatrist than before you see a psychiatrist. I think really, well, a lot of people think that, even GPs. Really, I think we have to introduce the idea that we can have an assessment that will not predict the outcome, but at least evaluate a possibility of the degree of risk. And then, if the risk is great, you have to be careful. If you have, like, a spot on your, the nematologist will say you should put a lot of cream and you should not go into the sun. So that's the same idea.
We are starting to have some early detection teams in Belgium as well.